Okay, good morning. Let's get started again. It's my great pleasure to moderate the second session on current status of mindfulness research and practice. So this is the continuation of the first session before the break. Before we start the session, I just want to say how excited I am that this new center is based in the Department of Nutrition. For those who are not familiar with our department was founded in 1942, more than 80 years ago. It was actually the first nutrition department in any medical schools or schools of public health in the world. So I'm very proud to say that we have very long and distinguished history of conducting cutting-edge research and training public health leaders globally. And our research is highly interdisciplinary, spanning from the genes to the globe, from the cells to cell phones, and from behaviors to the environment. And ultimately, the goal of our nutrition department is to improve human health and the health of the planet through eating a healthy diet and practicing healthy lifestyles. This is actually the mission of this new center. So that's why I'm so excited about this new center. And the mission of this center aligns very well with the mission of our department and our School of Public Health. And I'm very delighted to moderate this session. And I'm now going to introduce the speakers. Let's start with this first speaker, Dr. Diane Gilbert-Diamond from Dartmouth School of Medicine.
I'm a little short, so they gave me a stool to come. Well, thank you so much. It is quite an honor to be here. I'm an associate professor at the Geisel School of Medicine at Dartmouth, and I'm an alum of the Harvard School of Public Health and the Department of Nutrition. So it's such an honor to be here in front of the teachers that I've had for my doctorate and the teachers that I've had for the Dharma. It's just really a beautiful moment, so thank you. So 1 in 3 children in the US has overweight or obesity. And those children are at increased risk for so many health problems, physical health problems, mental health problems, during childhood and throughout their lives. And this really is why I went to the School of Public Health here, and what drives my research. The core of the work that I do is to help children to attain the healthiest life possible. And it just, mindfulness, as many of us know, is really a wonderful tool that can be used to help nourish children and help them to grow up healthfully. So in my research, I use neuroimaging. And in an MRI, we've shown that when we look at food images through our eyes, when we smell food through our nose, hear sizzling food in our ears, even taste or touch food with our hands, that we elicit these emotions and feelings that can then lead us to crave foods and desire to eat them. The Buddha said exactly the same thing 2,600 years ago. I didn't know that when I started my research, but I know that now, thanks to hearing many wonderful Dharma talks and reading many wonderful books by Thich Nhat Hanh. So with this very expensive machine, we've replicated and learned some of the knowledge that's really centuries, years old. We also learn, using eye tracking, that attention matters. So it's very funny to say that in a room full of monastics and mindfulness practitioners. But we also have followed where people put their gaze. And we found that when people are doing something, here a game called Tetris, which you may have played, or even when they're following their breath, of course, the mind will get distracted. And what we found is that when people have their attention distracted very quickly to food images, that's actually related to how much they weigh currently, how much they eat, how much they crave food. So again, we're replicating information that was discovered by the Buddha through reflection and a deep peering into his mind and how the mind works. So we also found that media multitasking, using multiple media devices at once, increases our distractibility and decreases our concentration and focus. And my research was really just focusing on media multitasking, using more than one electronic device. But what I've learned through the monastics is that we're constantly multitasking, not just with media devices, but when we eat and talk, when we walk and speak on our phone, we're always multitasking. And that multitasking can reduce our attention to how we're feeling inside. It can reduce our understanding of what we need to do to help ourselves be healthy. And it can also increase the doorways for influences, and not always healthy influences, such as food advertising for unhealthy foods. So I was giving a talk similar to this one at the Harvard School of Public Health Nutrition Department, and I felt pretty anxious because I had all of my teachers in front of me who I respected so much. I was a recent alum, and I was coming back. And in the back of the room, this woman was standing there, and I recognized her from my training, but she was standing there with this beautiful smile. And her presence, she was, as far as the back doors, but her smile just radiated this peace towards me at the podium, and my emotions calmed down. And really, this smile actually changed the whole course of my research, and honestly, the whole course of my personal life and well-being. So I feel so much gratitude to Dr. Lillian Chung for first her smile, and of course for everything that's transpired since then. So I actually am crying. Brother Phap Yung told me to cry, and I think that I did that. But really then, reading Thich Nhat Hanh's words, he talks about the power of a smile and how from a smile you can communicate peace, and that can spread and multiply and multiply. And through research, how many of us have touched peace through going to work? I mean, maybe others, but I certainly wasn't. And so this has transformed my life, and then my husband, my children, my sister who's here, and my students. So it was just amazing. This last week, we had 10 brothers and sisters come to our school at Dartmouth, and just the amount of lives that were transformed by their peaceful presence and their love and understanding was just amazing. And it all started from one person. And so thank you. So Lillian, after she gave me such a beautiful smile at the reception after, I went up to her and I thanked her for her kind presence and smile. And she said, "Do you know what's the opposite of multitasking? Mindfulness. Mindfulness is monotasking." And it was so true, but I didn't know yet how true it was. And she introduced me to Brother Phap, and we started this collaboration. So I had mentioned Dr. Chung, who you all know, and Brother Phap, who you'll meet on this panel, from Plum Village, and Dr. Orla O'Sullivan. We came together with Reina Hitotoki from my lab, and together we all collaborated on creating a mindfulness intervention for children based on the Plum Village tradition. So we took practices that many of you know to be beneficial, know really touch children and help children, and we're trying to package them and deliver them through a new means. So we have Brother Phap in the middle, giving the pebble meditation, Orla introducing mindful eating and mindful breathing. And really, this research isn't to try to prove that something that's done during the retreats is beneficial to kids. I mean, that's like trying to prove that sitting in the warm sunlight helps you feel good, right? That's not the purpose here. The purpose is trying to understand whether we can implement in a new way some of these teachings and deliver them broadly to many children who would never get to interact one-on-one with the monastics. So can we effectively do this? Can we inspire people to practice? Not whether the practices that are taught by the monastics are effective. So that first pilot intervention was just a very short intervention. And we found that the children loved it, and the families loved it, and they were very open to the teachings. And what we learned also is they wanted, of course, a longer-term intervention. And so together, we are developing a very holistic intervention, because the other thing that we realized in this is having a mindful eating intervention that only focuses on mindful eating really isn't enough. Because, of course, there are causes and conditions to the eating in that moment. How much they sleep, how much they exercise, how much screen media they're exposed to, their emotional regulation, right? So we broadened our intervention to be really holistic. And our hope is to equip children with the tools so that they can, through mindfulness, calm their emotions and really evaluate for themselves what is driving their behaviors and how are their current behaviors affecting their feelings of well-being. So it's not just that we're there telling them, eat fruits and vegetables, exercise, sleep. We're having them learn the tools to understand how they feel in the moment and what influences those feelings, and help them gain autonomy and freedom to change their behaviors in ways that benefit them. So this will look like the pebble meditation to everybody. These are really core Plum Village traits that are cultivated. We want to cultivate the curiosity that children have about themselves and how they're interacting with the world and how it's affecting them, how they can affect the world. To be able to calm themselves down so they can have a clearer understanding of what's going on in that moment. To help them develop feelings of solidity. If they're facing strong emotions, do they have to help them develop tools to bring their emotions down so that they can not just react to emotions, but they can calm down and move forward as they want to. And really the space that Ty talked about in his video, this space of feeling, well, I can't say it better than Ty, of course, so space and freedom. So this is what we're trying to cultivate together through our intervention. And really it's essential. This was a collaboration between the Plum Village community to really bring the core teachings that we know are effective through decades of working with children, and to really bring them into a broad disseminable intervention, broadly disseminable intervention. So I just wanted to share the 5 contemplations for children that Thai wrote, and this beautiful presentation was designed by the European Institute of Applied Buddhism. And I do have time to read it, so should I read it? We're reading this at lunch. So the food is the gift of the whole universe, the earth, the sky, the rain, and the sun. We thank the people who have made this food, especially the farmers, the people at the market, and the cooks. We only put on our plate as much food as we can eat. We want to chew the food slowly so that we can enjoy it. This food gives us energy to practice being more loving and understanding. We eat this food in order to be healthy and happy and to love each other as a family. So again, we're taking these practices, these very important, deep practices, and trying to help expose many children to them. So thank you very much for your time. I really appreciate this opportunity.
I'd like to go after you. I can stand on that same stool. It's very nice. It truly is such a pleasure to be here. I remember talking to Lillian actually in March of 2020. We were supposed to fly out for just a talk on mindfulness, and now we have a whole center. So great things come out of crises. So I'm going to spend my time today hopefully building on what we know around mindfulness to start to think about how we can better harness mindset to improve health in the 21st century. But to begin, I want to tell the story of Leo. So Leo, shown here with his mother, is a just delightful young kid. Great kid. But at the time I met Leo, he was really suffering from peanut allergies. So anyone in here who has a peanut allergy or who has kids who have peanut allergies knows that they are quite anxiety-provoking and very disruptive. Peanut allergies are highly prevalent. 1 in 20 people in the US have them. And they can cause intense anxiety because the mere exposure to peanuts can cause anaphylaxis or even death. Fortunately, we have great treatments that are being developed for peanut allergies and other food allergens. And one that's been developed recently is oral immunotherapy. And this is a process by which you take gradually increasing doses of the thing you are allergic to, and over time your body learns that it can tolerate that food. Now this treatment works. It works very well. The problem is that people are wary of doing it. They've spent their whole life avoiding this substance, and now they have to face it square in the eyes. And the process of doing that does create unpleasant symptoms like itchy throat, hives, upset stomach, and so forth. And when I talked to Dr. Kari Nadeau, who is the head of Stanford Allergy Center, she's actually here at the Brigham now, she told me, she said, we have this treatment, but people will not take it, or they're dropping out in the droves. So what we decided to do at the Stanford Mind and Body Lab was to sort of investigate this problem from a psychological lens. And so what we did was we first took a look at what the messaging was around symptoms currently. And what we found was that the message was, seemed pretty good. They were giving a warm, empathetic warning that symptoms might be possible, but they're just an unfortunate byproduct. So now this sounds not too bad, right? But if you think about it, if you're told that you might be experiencing symptoms, you might not only be worried about how bad those symptoms will be, but also about the deeper meaning of those symptoms. So if you or your child starts to get symptoms, you might think, oh, maybe the treatment's not working. Or maybe this treatment is toxic. Or maybe my body is not capable of tolerating peanuts. So this deeper meaning might be problematic. What we also found was another mindset was possible, another message was possible. And that was the message that the experience of symptoms during oral immunotherapy was actually a sign that the body was building up strength to tolerate peanuts. And in fact, if you look at the mechanisms of oral immunotherapy, that message is in fact true. You need to endure stress and struggle in the body in order for it to grow stronger, more tolerant, more resistant. But what we found was that this message, this positive message or mindset about the meaning of symptoms was not being communicated to patients. So what we wanted to do was see if we could change that. And we wanted to do a randomized control trial to see what the effect of different mindsets about the meaning of symptoms would be. So we randomized 50 kids and their parents to these different messaging around the symptoms that they were experiencing during the 7-month oral immunotherapy treatment. The information was given to them verbally by the doctors and nurses, but it was also written and portrayed differently in pamphlets. So you can see here the same information was given about symptoms and how to manage them and mitigate them, but the framing was different. And if you think about it, just a small change to viewing symptoms as a positive signal is really radical. Now when you experience those symptoms, you're not questioning the efficacy of the treatment or the capability of your own body. You're emboldened by knowing that this is working. I am on the path to becoming stronger. So 5 months into treatments, we went back and we asked these kids what they were experiencing, and in particular, we wanted to know what they would say to a future kid going through oral immunotherapy. So here's one of the kids in our symptoms as side effects condition.
And so what advice would you give to future kids who are going to go through this treatment who might be worried about their symptoms?
Advice to future kids would probably be just to follow the procedures that you tell them, and also, just hang in there.
Just hang in there, right? So it sounds good, and this is not bad, this is not wholly negative, but contrast that to Leo, who happened to be randomized into our symptoms as positive signals condition.
So what advice would you give for future kids who are going to go through this treatment who might be feeling kind of afraid that they're going to have symptoms? How would you tell them to think about their symptoms?
When you have a symptom, it is actually meaning that your body is fighting off peanuts.
I love this kid. He actually goes into the epigenetic explanation for how that occurs. Whew. It's a good one. All right, so you can see the difference. What did we find? Well, what we found when we measured them throughout this protocol was that there were some dramatic differences in how they experienced and also responded to treatment. So we found that there was a significant reduction in anxiety that these kids experienced during the treatment. This is the kit showing the kids, but we also found this in their parents. Any of you with food allergy kids know that would be meaningful. We found that there was a greater reduction in symptoms, in the symptoms as positive signals condition, but particularly when the doses were strongest, when they were the biggest. We found that there was far fewer calls from concerned parents about symptoms, really important health systems measure. And perhaps most importantly and interestingly of all, we found that the treatment worked better. So kids who are in the symptoms as positive signals condition actually had greater allergic tolerance as measured by IgG4 levels, which is a biomarker associated with allergic tolerance. Okay, so you might wonder, how could something as seemingly simple as a change in mindset or meaning about symptoms change the actual physical effect of symptoms? For many people, this is surprising at first glance. But if you think about the placebo effect and what we know from that, we realize it's not all that surprising at all. So in traditional drug trials, we compare a drug or a new treatment against a placebo. And in order to pass a new drug trial through, we need to show that it has some benefit, some statistically significant benefit, even if it's marginal over and above a placebo. But what we forget is that in the practice of medicine and healthcare and public health more broadly, the placebo effect doesn't disappear. It remains actively involved and at play. So the strength of that placebo effect might vary depending on the drug or condition, but what we know is that placebo-like effects can influence almost all of our disorders and diseases. They have subjective as well as objective outcomes. They have neurobiological mechanisms, so they're actually changing what's going on in our brains and bodies. And as we've shown, I see Dr. Langer here, we've shown in other research, placebo-like effects can play a role in determining the benefits of behaviors, health behaviors, like diet, like exercise, like sleep, and like stress. So if we know that the specific effects of any of our health treatments rely on placebo effects, it's important that we start to understand more, in a more sophisticated way, what those effects really are, what's driving placebo effects. And essentially, we distill it into 3 factors. So first, you have the body's natural abilities to heal itself with time. That's powerful, and we shouldn't discount that. But second, we have our mindsets, our beliefs, our expectations, the frame through which we are viewing this illness, this treatment, your body. Those mindsets can have an effect in part by activating or prioritizing the body's natural healing abilities. And of course, our mindsets don't come out of nowhere. Our mindsets are shaped by the social context, the branding of the drugs, the medical ritual, the public health messages. Those are things that shape our mindsets, which in turn can help activate our body's natural healing abilities. And again, it's not just the specific effects of drugs, but the specific effects of health behaviors that we're pleading people in this world to do. Exercise and eat. Yes, do those things, but also recognize your mindset about them. So when we realize this, when we see it this way, at least I'm empowered to say, you know what, we have a lot of work to do to better understand and to better harness what's arguably modern medicine's most profound and powerful structure, and that is the human mind. We've done relatively very little, and we have a lot longer to go. So how do we better harness this? Well, of course, as we saw with Leo, we can do a better job embedding adaptive mindsets in health communication. But by far, the most powerful possibility comes from empowering people themselves to consciously and deliberately change their mindsets. And this is precisely where mindfulness comes in. You've been hearing a lot today that mindfulness can have direct effects on our health and well-being, and that alone is enough to start this center. But I want to argue today that there's another route, an indirect route, and that is that mindfulness practice can also influence our health by establishing and empowering positive mindset change. So I'll just end on a personal note. I think at the end of the day, Thich Nhat Hanh is truly our greatest teacher. If he can stand in the face of tremendous suffering and struggle, such as the Vietnam War, we too can stand in the face of struggling and suffering and become stronger, not in spite of it, but actually because of it. I see Thich Nhat Hanh in Leo, as he was able to come face to face with the treatment, the symptoms, and really realize the power and strength of his own body. And I look at my own child in moments, and I realize, this was this moment after she got the COVID-19 vaccine. We're sitting there in the doctor's office. She got the vaccine, and she jumped up. She didn't cry. She didn't whine. She jumped up, and she gave the doctor a hug. And she thanked her for helping her body become even stronger than it already was. I see Ty in her in those moments too. So I want to thank all the creators of this incredible center. It's just another moment in the great movement that started many years ago, and I'm honored to be part of it. Thank you.
Hello, I'm Dr. Nicolas Van Dam. I'm the director of the Contemplative Studies Center at the University of Melbourne in Australia. A bit of a ways away. My body currently thinks it's about 2 a.m., so bear with me. Please, if you are in Australia would like to come, please come and visit our center. Our center was founded under not dissimilar circumstances to this one, through incredible philanthropic generosity, and in part due to a recognition of all the things going on in the context of the distress and the disease that John often talks about in the world more globally, and the recognition that came amongst many people in the context of the pandemic for finding purpose and meaning in life. Melbourne was one of the most locked down cities in the world. I don't know how many people know that. I think we spent over 300 days stuck in our homes during 2020. So we spent a lot of time, looking at our family and our house and repairing it and thinking about what to do. And lots of friends and colleagues spend time on their laptops working and looking at their kids playing next to them. And I have a fair number of colleagues who spent the pandemic thinking, why am I here working on my laptop when my young son or daughter is over there playing, and why am I not playing with them? And a fair few people really, as a result of that, have decided there has to be something more. And so now more than ever, I think centers like this are desperately needed. Now, what I want to talk about in my presentation really is, what do we do in the space of public health? And I think it's really essential that this center is situated in public health, because what we need to think about now, we know that mindfulness can help individuals, but we need to talk about what we're going to do at the societal level. We've heard about individual benefits. How do we cultivate or create the conditions that help individuals? We cannot just leave it up to the individual to change their circumstances. We need to think about cultivating those seeds that were planted all those years ago, 1976 in the 70s when John started his work, and ensure that the young sapling that is now the tree of kind of this field of mindfulness actually grows to be a strong tree over however many hundreds of years it takes within science for a discipline to become fully established. And it takes quite a while, and we've got quite a few challenges ahead of us. So I'm going to talk through some of those challenges. And the title here isn't intentionally meant to be a bit provocative. I love this card. I don't know if anyone's seen it, that there's cards floating around that says, what does mindfulness mean to you? And you're meant to fill it out. I would love to see the data if the organizers would be prepared to share it with me. This term mindfulness means something different to almost everyone that I encounter. And I guess the question, and Dave Hago talked earlier around, the Dharma is now being delivered by apps. Do we want multi-million and billion-dollar companies telling us what mindfulness is? We've got an amazing group of monastics here who have been thinking about mindfulness for a lot longer than the executives at some of these corporations. Do we want them to be defining mindfulness for us? And so when I came up with this title, part of it was defined as me thinking about the different versions of mindfulness that are out there and what those different versions mean and which versions we have evidence for and we might not have evidence for and how we think about it going forward. So I want to talk a little bit about what kind of evidence we have and some of the challenges. If you're not familiar with sort of a lot of figures and graphs, don't worry, I'll do my best to walk you through it. This figure here is showing what's called the standardized mean difference, and this is sort of a measure of effect size or how big of a benefit. And so you can see that dashed line, and that dashed line is basically showing you approximately where we see a clinically meaningful effect. This is as defined by Pim Kuiper's group for research on depression. So what you can see here is that, on average, mindfulness is helpful. So the blue bars are showing mindfulness-based practices, like MBSR. Now, an interesting question, and I should say these are considering mindfulness just on their own. So it's not comparing to active controls. There's a whole other story, as Dave Vago alluded to, when we consider active controls. It's a really different scenario. But mindfulness-based programs work relatively well. They reliably have clinically meaningful effects. Now, as we change the modality of delivery, which is what's happening, they're shifting to be shorter, they're shifting to be online, they're shifting to be digital. The orange bars are showing you the effects when we move things online. The gray bars are showing you what it looks like when we're delivering it by an app. Those error bars, our confidence that there is a clinically meaningful effect, goes away. And I think this is something that we really need to think about and consider. Do we know that we're still having an effect when we take something that's delivered in a group context with a lot of informal and formal practice, with teachings over multiple weeks in a community that's built? Does that look anything like what happens when someone sits down in their front room with their smartphone at whatever time of the day and listens for 5 minutes to Andrew Putticoat? It's an important question. Another thing I want to point out is that these are not entirely harmless. Right? If anything actually has potential to benefit, it may have potential to harm. And when we're talking, John mentioned earlier that this was not designed to be a treatment. MBSR was not designed to be a treatment, right? And so there are circumstances in which these things, when I say these things, I mean apps and various versions of mindfulness programs may actually make people worse. And it's really important to keep that in mind. There are scenarios in which people may be struggling or suffering with severe mental health problems, and us giving them an app in particular or a program in a school context may actually exacerbate their anxiety, their depression, or other issues that are going on. There are other conditions where it may just sort of cause new problems. One way to think about it is if you're sitting in a room thinking about nothing else, all of the things that you don't want to think about will come rushing to the fore of your mind. And I think Willem has pointed out in another talk that he recently gave, if we're equipping people with awareness of potential problems, but we're not then giving them the tools to deal with those problems, we are probably making the problem worse. A big issue, and this is where we start to get into the space of public health, is that when we think about where we're at with regards to the research, there's a model called the NIH Stages of Change model. And this is really designed to think about how do we come up with behavioral interventions. And so the bars to the left, there's a dashed line down the middle, are all the things we do early on in research in a given field. We do basic laboratory research. We come up with new interventions and programs. We do randomized controlled trials, often in really controlled university settings with weird, non-normal people that only have one diagnosis or, are healthy on everything but the thing we care about, people that don't exist in the real world. We find these unicorns. Anyone who's ever done a clinical trial trying to recruit a patient group that only has depression knows how hard it is to do these studies, because these people don't actually exist. So the stuff to the right of that is when we start getting out into the real world. And the point of this slide is to demonstrate that we've got a long way to go. Only about 10% of the corpus of research has been done in the real world. We've done the vast majority of our work in university settings and labs. That makes sense. It's a young field. But thinking about where we have to go into the world. We have to think about when people have these things in their hands, when psychotherapists, when school teachers are delivering these programs, do they still work? You can see that there's been some improvements. The red arrows show that randomized controlled trials with active controls have gone up quite a bit. This is just showing data for MBCT for depression up to 2017. And so looking at a period prior to that, we can see that there has been some improvements, but overall the percentage of studies being done out in the world are really still negligible. And it's something we really need to work on as a field. Now, the other thing is that our efforts to engage people are outpacing our evidence of efficacy. And so there's a really interesting slide here that one of my students, Nick Bowles, gathered, looking at the average recommended amount of practice. The top thing here is apps. The middle is meditation teachers, popular meditation teachers, I should say. And the bottom is mindfulness-based practices. So what you can see on the bottom is that in mindfulness-based practices, we're recommending about 30 to 45 minutes of practice. Teachers are recommending somewhere between 20 to 30 minutes of practice. Really interestingly, if you look at the same teacher, say a book by Joseph Goldstein from 1980 versus a book by Joseph Goldstein in 2010, the amount of practice they're recommending is getting less, right? Now, why is that? Is it that he was wrong earlier on, or is it that we're trying to engage people? I think it's that we're trying to engage people. If you look at the top, what you can see is that apps on average are recommending 5 to 10 minutes. Is that actually enough for people to see benefits? And this is a fundamental question that we have done very little, if any, research on. Now, Dave Vago also showed this slide, and as we think about apps, I think two really important things that didn't get discussed about here that I like to emphasize. This is a study of engagement with apps. And so this is looking at over the course of from someone downloading, and this is mental health apps more generally. It's not just a problem for mindfulness. This is apps, period. Mental health as well. Right? But what we're looking at is rate of engagement on the y-axis and the number of days since download. Now, the first thing to note is at day 1, we've already lost 40% of the people. 40% of people download an app, never open it. It doesn't matter how good it is, how much evidence we have that it can help people. If people do not use it, it will not work. Right? It's just basic logic. We look 7 days on and we've lost 90% of people. 90%. So you look at the numbers from app companies and say, we've got 5 million, 100 million downloads. Great, how many active, engaged users do you have? Right? It's meaningless unless we actually know how many people are actually using these things. When you get out to 30 days, we're doing well if we have 5% of people. So this is a huge challenge as we think about scaling these programs further than we already have. If we're going to do it via apps, we've got some huge issues on our hands. Now, the other thing is that when we start to think about how much should we be asking people to do, benefits take time and they change over time. So some work from one of my PhD students, when looking at the outcomes of meditators over different lifetime amounts of practice, we found this really interesting pattern suggesting that benefits are nonlinear. We often think of things as being linear. They accrue with the amount of practice you do, but in this analysis we found it's nonlinear. Right? Some of the greatest benefits for these individuals were earlier on. Quite interesting, we often think of it as the opposite. You know, you've been practicing for a really long time. That's when you are most likely to start seeing some of the real benefits. But this may have to do with the way that we measure these outcomes. Right? When you think about satisfaction with life or well-being or psychological distress or symptoms, what does it mean after you've been practicing for 10,000 hours or 20 or 30 years? I had a Buddhist monk come up to me once. We had given him a depression, anxiety, and stress scale. And he said, there's an item on this measure that says, life is empty. He says, do you want me to answer this the way that I believe, which is the Buddhist way of emptiness? Because I agree that life is empty. Or do you want me to answer it the way I think you do, which is that I think life is purposeless and I'm depressed? Because I'm not depressed at all. I just think life is actually empty, and that's good. And so this presents a challenge when it comes to the measures that we use, because if the person actually is understanding things the way that we want them to, when they get further on into practice, their understanding has likely changed. So all of that is to say, it's all too much and not enough at the same time. What we're doing, we're asking too much of too many people. We're pretending that these interventions are universal, that everyone should do them, that there's a one-size-fits-all. There is not. At the same time, we're not providing enough support for people who are undertaking this. So how can we provide more support? The last slide I have is this one. Keep the context in mind. When I originally started giving presentations of mindfulness, I wouldn't show this, because I thought, well, scientists aren't supposed to show Buddhist ideas or philosophies. And I went, this is stupid. This is what I do. I need to present the context. The context here is the Noble Eightfold Path. What's really important, and we already heard Eric allude to this earlier, mindfulness is one little piece there, a part of a much bigger wheel. Rather than pulling out another spoke, we need to think about the wheel. So what I love about the model of the Noble Eightfold Path is that there's wisdom, there's the worldview, there's the context, there's how people explore and understand and think about their world, but there's also ethical conduct. There's how people behave, how they act, what they do in the world, and there's community, how people are supported to do that, and then there's mental development. If we don't think about all of those things, if we only focus on pulling one little component out of this, we are missing the context. And I'm not saying that we all need to go out and become Buddhists, but we do need to think about this broader context and this model, because I think it is the model with which programs like MBSR were designed, that there is a broader context and we need to think about that context and cultivate it. And we need to move away from making it the responsibility of the individual to the responsibility of the individual and the society. Thank you.
It was more than 30 years ago that I had The Miracle of Mindfulness in my hands. And it was one of the first books in this area that I read. And I was just trying to remember what it did for me and how I engaged with it. And the two words that came to mind was, first of all, clarity. You know, that idea of a pond kind of clearing, the water clearing. And the other was a sense of an invitation to learn, a real joy in learning and a wanting to practice. And 30 years later, a bit like John, I feel like I've died and woken up in heaven. It's an extraordinary, extraordinary celebration here today with you all. What I'd like to do in the next 10 minutes is to describe 30, 40 years of work. And last night, I thought you'll all be a bit over-PowerPointed, so I abandoned my PowerPoints last night. But they have all the articles open access on them if people would like to read any of the papers I'm going to talk about. So I'm going to talk about translational science and the way in which ancient wisdom, what Thai brought into the world, into the Western world, and modern psychological science, and the way those come together to address some of the contemporary issues we have in the world. And I'm going to start with where I started with my career, which is with depression. We've already heard that as many as 250 million people right now in this world that we inhabit, with a little over 7 billion people, will meet diagnostic criteria for depression right now. About 1 billion will meet criteria at some point in their lifetime. Of those, only about 20% will seek treatment. In low and middle income countries, only 1 in 27 will get adequate treatment. And in higher income countries, only about 1 in 2, 1 in 3 will get minimally adequate treatment. That's usually medication. We have a major challenge on our hands. And you could say it's 1 billion people, but actually, if one thinks about the public health argument, if one thinks about heart health and mental health, you're actually talking about 7 billion people. And we're not going to manage that with therapies or with apps. We need a radical rethink, and centers like this, I think, are in the business of doing that. The monastics of Plum Village and Thai are in the business of doing that. So the translational journey that I wanted to take you on initially, I think, is a real success story. And I think actually translational science is always a success story, because if you do it well, you'll always learn something. And I'm going to tell it in 3 parts. The first part is around depression itself. And so translational science, for those of you who are not so familiar with this, is the way in which one needs to articulate a theory. How do we understand depression? What are the mechanisms that drive depression? And then develop some way of addressing those mechanisms, some treatment, some intervention, or in public health terms, some way of changing the dynamics of that disorder. Then you need to ask, does this work? And then finally, you need to cross the implementation gap. You need to make sure that you, I, anybody we love could actually go and access this thing that we know that works. And with depression, we're not going to handle it with antidepressants, and we're not going to handle it with individual therapy. Not to say those aren't effective, but there's no way the scale of the problem is going to be met by that. And mindfulness-based cognitive therapy was an attempt to begin to think about prevention. And it's a translational success story. What do I mean by that? Is the theoretical account that Mark Williams, John Teasdale, and Zindel Siegel came up with has been demonstrated, I think, very clearly by the science that they got it right in terms of thinking about what the mechanism of change was, and that the treatment addresses that. There is something within depression about the way in which the mind has this tendency to cognitive reactivity, getting really caught up, a bit like kindling in a fire, in this sort of negative downward spiral. And what people in MBCT, mindfulness-based cognitive therapy, are learning is the ability to see that, to step back from it, and meet it with a sense of kindness, compassion, and patience. Learning that skill is what happens in MBCT, and it's what's associated with better outcomes. We see that with self-report. We see that with experimental tasks. We see it with emotion regulation tasks, where you look at things like heart rate and heart rate variability. And in a recent study that actually Sarah and I were co-authors on, we saw it with some changes in the scanner as well, post-treatment, when people were invited to ruminate. The second part of the translational journey, then, is does it work? At least 10 randomized controlled trials published in some of the most prestigious journals have demonstrated the answer to that is yes. Lancet, JAMA Psychiatry. We have shown that mindfulness-based cognitive therapy prevents depressive relapse. and is an alternative to maintenance antidepressants. That's non-trivial. Hundreds of millions of people around the world are on maintenance antidepressants. We've given them an alternative. We've also done a lot of work to show that it can be implemented into healthcare services. And we know how to do it. But, like Nicolas's slide, there is a big gap between the reality of implementation and the need for it and knowing how to do it. I actually don't think that I agree with Nicolas in his analysis. I think it's about paradigm shifts. It's about the sort of thing that Eric was talking about, health insurance companies. It's about us saying to our physician, I want something preventative. I know you want to write me a script, but actually that's not what I want right now because it's ruining my sex life and my marriage or whatever. I want to have a different approach to managing my depression. So I think it's about a paradigm shift, a move towards prevention. So I think this is a real success story of translational science about how to think about the prevention of depression. We took the next step, and this has been a real, John described it as a wake-up call. We realized that most mental health problems first arise in late adolescence and early adulthood. And that kids are learning these skills. Their brain is developing a lot right up to the end of adolescence, 24. And that if we can get in before kids first develop mental health problems and teach them the skills to prevent that from happening, that could be an extraordinarily powerful thing to do. So we set up an 8-year program of work in which we wanted to ask, can we, through the delivery unit of schools and secondary school teachers in representative schools, teach children mindfulness skills as a way of staying well in the long term? A lot of people are nodding. So did our funding agency. They gave us £6 million. I guess that's about 7 million, I don't know what it is in dollars. They gave us a lot of money over 10 years to answer that question. And we thought, well, that's a lot of money, and that's a chance to do this work really well. So we set out to do it really well. We spent 8 years doing it. We recruited 28,000 children across the United Kingdom who were actually representative of children in the United Kingdom. We recruited over 100 schools, and again, they were representative of diversity, of state-funded and so on. And we recruited, I think, 650 school teachers to help us with the delivery of the program. And we have 20 million data points that we collected over the course of this study. It's a huge undertaking. And we had a whole bunch of things that we set out to try and learn. And I'm going to just summarize, I think, the main things that we learned from this work. It's all been published now, and there's at least 20 peer-reviewed papers describing this work. The first thing that we wanted to know was whether or not what we thought was the case with young people's mental health was indeed the case. An epidemiological question, if you like. We had a representative sample. And it was. As many as 1 in 3 young children between 11 and 16, representative of the UK, are telling us they have significant mental health problems and challenges. I don't know about you, but I don't think that's acceptable as a society. 1 in 3 of our young 11 to 16-year-olds is telling us they've got significant depressive symptoms. We had other measures as well. The second thing, which is really helpful, and those of you who work in education might find this reassuring, is we were able to ask how much of the variance in young people's mental health is actually determined by schools, and how much lies outside of schools. Not just in our data, but in the data more broadly, it's tiny. Somewhere between 1 and about 9% of the variance in young people's mental health can be explained by school-level factors. That means other things are explaining those young people's mental health over and above the school. So we can't say as parents or as governors or anything else, schools, you sort out our children's mental health problems. That's not going to work. We did a cluster randomized controlled trial, 8,800 children, delivering mindfulness training to these kids to ask, does the mindfulness training improve the mental health of the children? This was our primary outcome over a one-year follow-up, luckily just before the pandemic. Luckily, I mean the data was in before the pandemic. We had 3 co-primary outcomes. We were fully powered. We worked really hard to make sure that the mindfulness training was delivered really well. This is a schools level, universal mindfulness training. Just to contextualize it, because I know there are other ways of doing this. This is UK secondary schools. There was absolutely no impact on the young people's mental health. I'll say that again. There was absolutely no impact on the young people's mental health. I'll come back to that in a second. We had a range of secondary outcomes, including the teachers and the school climates. The teachers themselves went through a mindfulness program in order to be able to teach it to the children. The teachers' mental health did improve. That's non-trivial, right? That's non-trivial. A lot of teachers are very stressed. They're leaving the teaching profession. So doing anything that can improve the mental health of teachers is time well spent. The school climate was also improved. The culture, the sense of trust, the sense of respect, the sense of mutuality within the school was improved. Was mindfulness and executive function important to the children's mental health? Yes, it was in our data. Did the mindfulness intervention teach them these skills? No, it didn't. So I want to just kind of see what we've learned from this and what maybe we can learn from all of this going forwards. The first thing I think we can learn is one size does not fit all. What we found is that some of the children did benefit, the younger children who are really well, and some of the children, the older children and the ones who are well, and some of the children got worse, a bit like what Nicolas was saying. The children who had more mental health challenges were made worse by the mindfulness intervention. Probably for the reason that Nicolas said. We're making them more aware of some of the difficulties in their life, but not giving them enough tools to work with it. And UK secondary schools, those of you who know about them, they're pretty tough places to walk into. They're not mindful environments. The second thing that we learned, which I think I'm going to end on this because I've just had an end of session note, is that one of the biggest predictors of young people's mental health that we found in our data was that the culture and the climate of the school was really important to young people's mental health. And I think maybe just end on that note and come back to Thai and say that maybe from ancient wisdom and from modern psychology, we need to be thinking about this word climate. And what do I mean by that? I mean the climate of schools, the climate of workplaces, the climate of higher education settings. We need to be thinking about the ethical climate in which we're operating. To make very explicit the idea of the ethical compass that we're using in any work that we do. And Thai was invited to speak to the UN climate change crisis, I think in 2014. And he spoke about something which I've started becoming very interested in recently, which is called endosymbiosis, but he didn't call it that. He wrote to the UN and said, I think you need to have a radical rethink about the environment. Because it isn't that the environment is out there and you are here. You are the environment, he said. And then he said, look around you. And when you look around you and you see outside of you, you're not seeing outside of you, you're seeing you. And what he was pointing to was this idea of climate, this idea of culture. And I think that's where we're going with the field. And I think to really echo what Eric was saying, my invitation to this new center is be brave. I actually even think public health needs rethinking. The old Jeffrey Rose argument, I love it, but let's rethink it. Let's rethink what flourishing means. Let's rethink what well-being means. Let's rethink what a culture and a climate that is about the flourishing of the planet, which means also us, is the same thing. Thank you for your attention.
So I'd like to invite us to come back to our body, be aware of our breath. We'll listen to the sound of the bell. My brother Peace will also not only invite the bell, but invite it with intention. When we invite the bell in our tradition, we say, body, speech, and mind in perfect oneness. I send my heart along with the sound of this bell. May all those who hear it awaken from forgetfulness and transcend the path of anxiety and sorrow. So we set an intention. So it's not just a bell sound, but it's our heart which is being transmitted with the sound of the bell. So I invite you to listen with every cell in your body, as our teacher would often say. Let the sound of the bell penetrate every cell, inviting you to wake up to this precious moment. Open our eyes. Maybe we can take a moment just to look around at each other and smile. I was not raised in any religious tradition, but my cousin was raised as an altar boy in the Catholic Church. And my favorite part when I'd go to Mass with him was when we'd turn around and look at each other and say, "Peace be with you." So I don't know, can we do that? Is that okay? Yeah. Peace be with you. 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 So we've traveled here today, the Plum Village delegation of monastics, and many of our friends who have been part of our community for many decades as students of our teacher, Zen Master Thich Nhat Hanh, who we refer to as Thai, so that we could bring our practice energy here and cultivate what we call collective awakening. And so what we've been hearing about today, what Dr. Walter Willett, Dr. Harvey Feinberg, Dr. Lillian Chung, and all of the presenters have shared with us is kind of deep looking into what is it that brings about this connection, this sense of awareness to our body and mind, and how can that affect us? So I'm really inspired by this, and I think we all are looking for ways of how we can build a larger community, because what I'm hearing in these presentations is how do we scale this up, right? But there's something inherent in that question of scaling that removes a human being. So we have to be very careful. The poet and writer Wendell Berry wrote a book called What Are People For? And I love the title of that book. I recommend you read it. It's a very deep looking into our culture here in the United States. It's a little bit dated right now, but I think the essence is still there. We need to look, what are we here for? And we have to understand that when we're starting a center for mindfulness and public health, that kind of question is essential. What are we here for? So one of the things I'd like to talk about is community. I think one of the things that we, as in this form, as human beings on this planet, we are here as community builders. And like John shared earlier, this is something inherent in us, just like mindfulness. Awareness is inherent in us. So it's not something you have to try and get, right? But it's something to understand that we have the capacity to build community. But we also have the capacity to fragment and to separate. And so what I find so beautiful about having the center in the School of Public Health is that we're looking at the collective, not just the individual. Because we know, as Tai often told us, that happiness is not an individual matter. So we can have data points of one person being happy. But how do we create a happy school? How do we create, as you shared, Willem, a culture where happiness is what we do? So this is what Tai spent his whole life doing. And we are also his continuation. We are products of that. But we are also continuing that. So we are finding ways to continue to build our monastic community as lay friends, as mindfulness practitioners, but also deeply concerned people on this planet. And so I'm aware I'm preaching to the converted a little bit here. But what I'd like to do is just use this moment, this maybe 10 minutes, to just see how we are building community in our life. And I also want to talk a little bit about ethics, which is, I'm very glad that Willem brought up that point. Because I think these 2 points are essential to where we're going in the 21st century with mindfulness. Eric pointed out, I was very touched to hear Eric's presentation. Actually, we practiced in the old Pasanga here when I was more than 20 years ago, when I was a lay person. And now at that time he told me about public health, but I was just so concerned about Buddha Dharma and becoming a monk, I didn't think much about it. But I'm grateful that he shared that mindfulness is only one part of this eightfold path, right, that the Buddha proposed to us. And we have to remember as well that the Buddha didn't feel he was inventing something, but he was discovering an old path which was already there. So I can say that another way. He was putting in words something that was already there, is already inherent. There's nothing you need to do. You just see the path and you walk it. And so Tai often said, happiness is not a destination, it is the way. There is no way to happiness. Happiness is the way. So so part of planning this symposium has been, are you guys happy? I mean, are you enjoying this symposium? Yes, okay. Excellent. And that is built into it, right? This is thanks to Lillian, thanks to many, I've heard little sparks coming out every time I would get on a call with Lillian. It's, oh gosh, this and that. All this love and care has come into bringing this community together. So my deep wish is that it doesn't end here. That we see that this is a branching off point, and that all of us need to be doing this work, not only the ones who are presenting up here, right? It's very noble. I think it's a noble profession as a scientist today to be looking into the effects of mindfulness on children, on teachers, on schools. But how can we continue to build community? Even we are not a scientist. Maybe we are businessmen. Maybe we are a financial analyst. Maybe we are working with disadvantaged youth in the street. We don't need to have a position or a research endowment, right, to do that study. So this is something that I think we need to reflect on as we continue to grow this movement. So the Buddha talked about mindfulness, concentration, and also insight. So it's not mindfulness alone, but it's also the sustained practice of mindfulness. And that gives us an insight. And Tai often said, you get the insight that you have a body. That's a very profound statement. You think, well, of course I have a body. But we forget all the time that we have a body. And we are bodies sitting here, and we are feeling the collective energy of mindfulness that is generated by our attention. So mindfulness, concentration, and insight are the basis of our community, and they are part of how we build a culture in the monastery, whether in Plum Village or Deer Park Monastery, Magnolia Grove, Blue Cliff, our centers around the world. These have been planted as ways for us to come together in a space where we feel safe, so that we can do the work of being scientists ourselves. It means going in, a first person looking into, what is my experience? Right now, let's try an example. So in the Buddhist tradition, we talk about 5 universal mental formations. So there's contact. So when you see this monk standing here, you see the photons bouncing off my robe and my eyes are impacting your retina. And that is giving an image in your mind, right? So there's contact leads to a perception. So there's some kind of perception. There's a monk, and you want to know, what's his history? What's he doing? That your mind starts to fill in all the time. There's a feeling. Maybe you have a positive feeling. You see a monk. Maybe you feel, oh gosh, I don't trust somebody in robes. You have a little bit of negative feeling, but it's not important. It's that's always going on. This is happening very, very quickly. There's then volition, which is nourished, right? So you direct your attention somewhere. And that's the 5th one. So these 5 formations are part of the Buddhist tradition, and they came from the deep looking of practitioners. And I'd like to suggest that we use this opportunity to have a center for mindfulness to look into all these aspects of the Buddhist tradition that, 30 years ago when John started doing MBSR, we couldn't talk about, right? I remember reading a great article where John, you said when Tai wrote the preface to Full Catastrophe Living, Tai wrote Dharma, I think 3 times in it. 4 times. Dharma, 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 Dharma. And you wonder, what is going to be the effect of that? And maybe people just flip by that page. But now there's this openness which is happening, and I really want us to make good use of that, not in a way that we become caught in Buddhist doctrines, but rather we look at it as a source book. It's this great, for me, I was depressed when I was 24, and my mom is here. She let me stay in her house for a few months. And when I discovered this practice of mindfulness, the 4 foundations or 4 establishments of mindfulness, it transformed my life because I realized that I could generate joy within myself, right? Just by bringing attention to my body, to my breathing. And so by doing that, I knew that I wanted to live my life and offer this practice. And that's, I think, we've all touched that similar type of kind of insight in our lives, and that's why we're here today. So I'd just like to say that we for me, the community aspect and the ethical aspect of the Buddhist path, we can use all of those suggestions rather than looking at them as doctrines or dogma, but rather use it like a source book. For me, that text, the 4 establishments of mindfulness, was like the manual of life that I never got when I was born. It was finally teaching me how to be with my body, how to be with my breathing, so that I could understand how my mind is functioning. So teachings like this, these 5 mental formations, and I kind of like that term. I mean, we use emotions, we use many different terms in psychology. Using them as sources of insight, as experiences of meditative practitioners in the past who didn't have the kind of instruments that we have today to measure these things, as inspiration for us to continue to build community and continue to go on this path together. So thank you for listening, and I hope this is I've never spoken in a session like this before, so please excuse me if I behave inappropriately.
Hey, thank you so much, all the speakers, and just wonderful, wonderful presentations and the insights, and it's truly moving. Unfortunately, already at lunchtime, we have to postpone our panel discussions to the afternoon. So again, thank you so much for your wonderful presentations. of course, we're going to have a mindful lunch. I have a few instructions for the lunch. So the lunch will be vegan or vegetarian. So if you're looking for a beef sandwich or something like that, you're not going to find it. The mindful lunch will take place on the first floor in the cafeteria. And you can help yourself to a table quickly and mindfully. And please note that some tables are reserved. Sister Boy Nania will provide mindful lunch instructions and invite the bell. And please take your time to safely exit the auditorium. And we will meet at the cafeteria located on the first floor. Yeah, go ahead.
Yeah. So for the mindful lunch, it'd be wonderful if we could enjoy our step as we walk up to the cafe. And I think we might be using as well an overflow, or so we'll try to fill up the cafe first, and then there'll be people to guide us if we need to go to the overflow room. And Sister True Pearl, Sister Boynim, will be there to guide us in how we practice eating meditation. And we'll practice eating in silence for 10 minutes. So, yeah. So please, we can mindfully walk up.
Thank you.